I looking at camera 3?
Coming up, cleaner air means better health. But when the air isn't clean, what does that actually do to our body? A new report finds millions of Americans are living with unhealthy levels of air pollution. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Air pollution in America isn't as bad as it used to be, but after decades of progress, more than 119 million people still live in places with failing grades for unhealthy air quality. That's according to the newest State of the Air report from the American Lung Association. It measured two of the most dangerous air pollutants, fine particles and ozone. It found more than 1 in 3 Americans live in places with unhealthy levels of air pollutions. Here locally, both Wyandotte County, Kansas and Jackson County, Missouri earned a D for high levels of particle pollution. To help us understand what that really means for our health and most importantly what we can do about it is Dr. Bill Barkman. He's a pulmonologist, a lung doctor, and an environmental health specialist. He used to lead the Center for Environmental and Occupational Health here at the University of Kansas Health System. Enjoying a little retirement these days, but we love it when you come in here and hang out with us. How are you?
I am fine. Yourself?
Good. I always like it when you come in and talk about this. It's kind of a little bit of a different topic, and it's something that affects us all in different ways. So if you check the air quality, you get a couple of different measurements. There's the ozone and there's the particulate matter. These are the tiny particles. Yes. They're written out as PM10, PM2.5. So don't know what that means, but you're going to help us understand really what is ozone, first of all, and what happens when we breathe that in. We hear that word a lot, but really what is it?
Okay, ozone's it's a combination of 3 oxygen molecules. It's an oxidant, and when it's inhaled, it causes inflammation, and it can cause airway reactivity and worsen your asthma. And so in those particular cases, when in the cities, they get ozone alerts, meaning that the levels are high and you ought to change your activity level. One of the reasons over time, too, is because of medicine, we have improved life for people with chronic illnesses. And so we have populations that are risk more than we used to. But anyway, ozone, how do we get ozone? Well, in the stratosphere, it's a great thing because it blocks radiation coming in from the sun. But at ground level, it's no, we don't want it there. And where do we get that? What happens is that the emissions, you get nitrogen dioxide, you get VOCs, volatile chemical compounds, and with the sunlight, and they combine to form ozone. So do we see a lot of it every day? No. But in the summer in the Midwest here is when we are at highest risk for it because there's more sunlight and with the high pressure center comes in and air doesn't move and it sits there and cooks it, and then you get ozone. So most of the time in the Midwest and Kansas City, we're going to see ozone alerts in August, July, August. We're not going to see them in January or this time of year. Because again, right now there's so many, what do you say, with switching over to spring, you got all these fronts going through, with pushing air through, and you're just not going to see it.
So it's this hot, stagnant air that
it cooks it.
It
cooks the combination of the emissions.
And it's unavoidable, basically?
Right. I mean, again, you're going to see some of it if you have emissions, yes. But again, at real low levels, some people think it even has a health effect. Now, that's very controversial. But again, we know at the levels, because they've done research on healthy people, what levels can be done before you start to see health effects in the lung. And so that's how they come to some of these standards. And how you decide what we need to send an alert out for.
So the American Lung Association shared this video explaining particle pollution. Tiny particles can travel deep inside your bodies. So where do these particles, Dr. Barkman, come from? How can they hurt us or damage our insides?
Well, again, there's actually 3 levels. We only routinely measure PM10, which is the particle size, 10 micron. And 10 micron, we can't see. Okay, if you were sitting in your living room and you see the sun come through the window.
I was going to ask you about that.
And the smallest particle you can see there is probably 50 microns. So we can't see 10. We can't see 2.5. It's there. And when you see this smog and all, that's pollution that probably doesn't get into your lung, but inside that cloud is what gets deep in your lung. Now, we used to only measure 10, and 10's kind of the upper limit of what can be inhaled. And so we went to 2.5 because that gets down into your lung further. And now there is PM ultra small particles that are sort of PM.1. And so what happens is, and in these particles, they aren't solid. Some of them can be liquid. And they come from all sources. It comes from the crust of the earth, dust blowing. It comes from fires. It comes from emissions in cars. It comes from emission in coal plants. So it comes from lots of different sources. And again, and it can be carried a long ways.
So
because
but the smaller the number, the more it will embed in the lungs.
Right.
So when we go back to the sunlight in our living room, we see these particles dancing around in the air. And you said those ones we can see are about 50. So where do those go? Because we have to think we're
they're
breathing
blocked
them in.
out. They get caught up in the upper system.
Gotcha.
In terms of the upper respiratory tract. They don't get below your vocal cords.
So how do we just get them out through?
Yep, we just get them out.
Blowing our nose and
right,
coughing it out.
Right. Well, in this time of year, I mean, you know, what's our biggest problem now? It's allergies from pollen. And, you know, most of that's too big to get into the lung. But you're always blowing your nose and coughing, getting the stuff out. So anyway.
So let's talk about the proximity in which we live to this, because that's what people are wondering. Where do I live? What's my air quality like? Is it fair to assume that this particle pollution is closer to busy streets, highways, or is that just one factor?
Just one factor.
Okay.
And locally, you're going to get, well, there's some manufacturing that produces it. People always talk about coal plants. And that, of course, engineering's helped to reduce the amount of nitrogen dioxides that have been emitted. And then, of course, you have, from, like you say, from cars. And then you remember last year when there was sort of a haze and we were seeing the smoke from the wildfires in the west? Well, that part of the year, though, that was brought that far from the West Coast clear to the Midwest. And, you know, we had to clear that with rain and wind to get all that out of the system.
Just the natural systems,
natural
moving it
systems.
through. Who is most at risk when it comes to air pollution, as far as health conditions, age, any other risk factors, but who's impacted most?
People with lung disease, asthma, COPD, and again, there's a fair number of people that have that. It's a common illness. And again, those are the most at risk. People, but it also affects other people. I mean, people with cardiovascular disease, I think it's noted that there's more arrhythmias in people when we have air pollution. And it's been noted to have some effect in pregnancy, although most of the time I don't think people around here are exposed enough to actually cause a problem there. Stillborns, premature deliveries, etc. I don't think that's a huge issue here, but in some areas, maybe other parts of the world where pollution's worse, that is a consideration. The
American Lung Association estimated some of the at-risk population in the greater Kansas City metro area. The total metro population, of course, is around 2.5 million people. There's around 590,000 children under the age of 18. 390,000 adults over 65, 43,000 kids with asthma, 195,000 adults with asthma. And here are some of the numbers for COPD, cardiovascular disease, as you had mentioned, pregnancy, lung cancer. Really goes to show there's a ton of at-risk people just here in the metro.
Correct.
It's not just people with existing lung problems. But you said before we started this program, we don't want to scare people because amidst all of this, being outside, fresh air is key.
Right. And you can go to both Des Moines and Lincoln are some of the cleanest cities in the country in terms of air pollution. So again, putting it in perspective, yes, we can do better. But on the other hand, we're not at risk where everybody has to worry every day and be checking their phone to see what the levels are. Now, in the summer, you want to track the ozone. And if you have asthma and you're going to exercise, you want to be sure you do it at the proper time and not when the levels are highest. But remember, in that report, it only talks about 8 counties in the state of Kansas that there's monitors. Well, why is that? The Lung Association uses EPA data. And EPA sets those monitors where they think there could be a problem. They're not just set randomly out. And so they're looking for that to see if they're in, and then they can work their way back to see what improvement they can make on it. Why is it higher here? And one of the things science needs to work on is we say PM 2.5 or PM 10. It doesn't speciate what that actually is. Is that dust from an agricultural? Is that, and so that's expensive to sort that all out. But part of that we need to know in order to cut down on the production of it. For instance, in Kansas, with the prairie fires, the EPA and them have worked out a deal with the state on how many acres they can burn per year, because it does affect the health of those folks that are downwind. They're going to see more asthma visits to the emergency room, and that's the one that's easiest to come up with. But again, it can affect people with COPD also. And again, when you think about COPD, management of that, I mean, we got people on home oxygen, we got people on drugs that now live longer than they ever have. And so we've created that risk population. So at any rate, we don't want people to over-interpret this information. And every county probably has an air quality group that's monitoring. I mean, the state of Kansas does, and locally here, MARC exists, Mid-America Regional Council, and they work on that, and they work on it with the EPA. And so here there's concern about it, and that MARC work, and that's an, I think, 9-county area that works on this.
So when we talk about Wyandotte and Jackson counties, both received a D. What is that? When we hear D, that doesn't sound good, but what does it really mean for people living, and why do you think those particular counties got that grade?
Well, I think in Wyandotte, we've got that rail system over there that sits there, and I think that plays a role in it. And in terms of emissions, I'm pretty sure that is one of the factors. And I don't know about Jackson. And I think the problem is we don't know exactly where those monitors sit, and you'd have to talk to the EPA and maybe some of the folks at MARC about, okay, what is the difference between where that monitor sits and, say, 95th admission, and to get that information. So, but I do think on the Kansas side, the issue relates in part to where that the train traffic through there and it sits there. And there's been some environmental justice system things that come into play there. People saying, if you live in the Argentine, you're at a, is this an environmental justice issue? Why aren't you improving that? And so, that can get politically real quick. But I think the EPA's role is trying to identify where these areas are and then put a plan in place to decrease them, because they move the monitors around based on where they think there may be a problem. And so, just because most of the counties don't have actual numbers in the Lung Association report doesn't mean that there aren't potential issues, at least locally, maybe part of the time. Of course, you get in the rural side and you got more issues with dust and potentially if you're out there with the prairie or they're burning it, you don't have large manufacturing. You don't have as many emissions. And so,
but those areas can change over time.
And you can get that carry from other areas like we saw with the wildfires last year.
Well, and I want to bring out that point because the worst air pollution was stated to be, of course, in the western U.S. 23 of the 25 worst cities for short-term particle pollution were in the West. We talked about the wildfires. What else?
Well, out there it's the population and the emissions from the vehicles. There's just, again, and if you go back to when the Clean Air Act went in, you could see the smog in L.A. It was phenomenal. So we've come a long way, but we can still do better. And again, because asthma is a common illness, we want to do the best we can so we don't have people having exacerbations and requiring going in and requiring medical care in the emergency room.
I was sharing that story with you that one of our colleagues who worked here on the Morning Medical Update moved out to LA, had spent his entire life here in the Midwest, moved to LA, and then came back just a few weeks ago for the first time. And I said, what do you notice? What's the biggest difference? And he came back and he said, the air. I was thinking he was going to say the sun, the beach, the people, the food, all these great things, living the California dream. And he said, my gosh, the air quality. I mean, you don't realize it until you move out of it and then come back and know what you're missing. So we're not as bad, even though we read these reports.
Well, the map you had up there, the Midwest, there's just not much there. Of course, the population's down. I mean, there's a lot more land per person, so to speak. And we have the swings in the environment. I mean, again, the wind, the rains that are associated with each, cycle. In the spring. So again, we have an advantage of the four seasons in a way.
Sure.
From that standpoint.
So we know one person can't fix it. It takes us all doing it, working on a singular level. But what can we do on an individual level to really help our lungs, help with the air quality? What are some suggestions or tips do you have?
Well, first of all, again, staying aware and being an advocate for clean air. I mean, I think, the government's working on it, both local and national, and we need to support that. I mean, we need to get because it affects everybody. I mean, the lung is exposed to the environment, and, if it's not healthy, we're going to see more health effects. So it's common sense. In terms of a personal thing, first of all, if you can avoid using, cars with the emissions. I mean, if you're just going to go a couple blocks to do something, walk it. Okay. In the summer here, when it's most at risk, they're always telling you to fill your gas tank late in the day, as the sun goes down, again, because you don't have a chance to cook all of that. From a standpoint. Again, in terms of your health, if you're going to exercise and you have health challenges, you need to do it at times when the levels are low. You don't want to be out there in the mid when the ozone levels are high or the particulates are high, so you pay attention to the alerts. In terms of potential chemicals, VOCs, volatile organic chemicals, compounds, a lot of house cleaners and various things have those kind of compounds in them. And if you use compounds that don't have those, that helps, because the VOCs contribute with the nitrogen dioxide to end up cooking to cause the ozone. There's not much you can do about the particulate except decrease the use of an automobile that has emissions.
Do you think the state and federal levels are doing enough, in your opinion? How far have they come? How far do they need to go?
Well, put it in perspective. Okay, the Clean Air Act came in around 1970, and I think the EPA was started in about 1972. And so we've been at this a while. And there's clearly been progress. I mean, if we had more resources, could we make them faster? Potentially. And the other thing is the science and the technology's changed. We're measuring 2.5. Now we're doing ultra fine and trying to look at the health effects of that. And so I suppose we can always move faster, but some of these things take time. In terms of one of the things that's come out in the last 3 years maybe is air pollution is a risk factor for lung cancer. Well, how do we sort that out?
Right.
And because it's a kind of a dose response. How much pollution can you take before you potentially develop that? Well, lung cancer is more complicated than that. There's genetics to it also. But I think it's another sign that we need to keep working on air quality, because it has more health effects than just affecting people with airway disease, asthma, or COPD. It has greater effects. It affects all of us. And so anything we can do to support the research, the Lung Association supports research, the government reports research. I mean, I think the current administration is going to place more monitors. I think, I don't remember how many, but I think they put aside $53 million to put monitors in more areas, west and east. They're not going to be in Missouri and Kansas because we have pretty good air. Even though we may say it's a D, it's not something we have to worry about on a daily basis. But we have to continue to work to keep, Mark and those people working on this to do the best air that we can have.
If you have questions for Dr. Barkman, use the chat on YouTube or Facebook. You can tweet us or email us at the Medical News Network. Info is right there on your screen. Let's get a check on our COVID count with Dr. Dana Hawkinson. Good morning.
Hi.
Hey, how are you?
I'm good.
Good.
Yeah, right now we saw a little dip in our active cases. We have 31 total, 14 active compared to, I think, 18 yesterday. 3 in the ICU and 0 on the ventilator.
All right, Doc Hawk, we know COVID-19 vaccines are safe and effective. You've been saying that for quite some time.
Yeah.
But explain this headline to us that it can kind of get twisted and people don't understand what they're reading. COVID-19 vaccination tied to increased risk of developing Bell's palsy. So we say the vaccines are safe, but that study found a link between the vaccine and Bell's palsy. What gives with that? Explain the headline so people who are not diving deep into that study.
Yeah, so if you remember, Bell's palsy is that affliction that affects your facial nerve where you aren't able to move one side of your face. It's typically temporary. Again, this was a really good headline. This was based on an article published in the JAMA network. It is, though, when you look at the study itself, we have to be understanding of what the caveats are. This is a meta-analysis. So basically what they did was they took a bunch of articles, a few dozen, and tried to compare them to each other. And so when you do that, you already have inherent biases and caveats to the results and the conclusions made. What they did show was that there was an increased risk of having that Bell's palsy for those people that did receive vaccine, and that's whether it was an mRNA vaccine or any of the other vaccines that were available, as compared to people who didn't. They also did show 7 or 8 studies which showed no increased rate as well, so we have to take that into account. The other thing they did show is that your risk of getting Bell's palsy with the infection, with SARS-CoV-2 infection, was actually 3 times higher than if you were getting the vaccine as well. So again, we know that the vaccine is safe. We know that it can have side effects. This was a good article, but it was a meta-analysis, so we have to understand just the difficulties and the caveats in that. But overall, we also have to understand that when you actually get the infection, your risk of all these things, including Bell's palsy, is much higher than with any vaccination as well.
Any reporters with us today? Let's get to our community questions. Can particle pollution cause cancer? Paula wants to know.
Lung cancer, yes.
Lung cancer
Yes.
only?
At this point, yes. And again, those are epidemiologic studies, so trying to sort that out down to one person or what your risks are if you live in Kansas City all your life. We don't have the science there to say, yes, it comes from that. And remember, we did a lung cancer thing. Smoking's still number 1 in Kansas and Midwest. Radon is important, and test for that. And then there's a group, maybe 20%, we don't know the cause. So out of that group, air pollution could be, and it's the PM piece of it, that would be the potential source.
Yen Liang wants to know, could using an air purifier and keeping doors and windows closed at the right time help? And people always want to know about those air purifiers, how much they help, what they're supposed to be looking for and reading on the box.
That's a little tricky. In terms of particulates, if you get one that's HEPA filtered, it's very small, kind of like what we use here in the OR, they're going to cut down on the particulates. Not as many particulates come into the house as to the outside. I mean, you do have leakage, the air gets into your house, and I think the smaller particles, the 2.5 and all, get in at that level. And again, not all of the HEPA filters will cover the ultrafine, but thank God we don't have much of that here in this part of the country. So in terms of particulates, yes, HEPA filter will help. In terms of ozone and that, you're really not going to have any way, I don't believe, of those I just don't know that they've been cleared by anybody to say this one's better than another. Some people swear by them, but I can't tell you here. I'm not prepared to discuss that.
I get that, yeah. So, but again, they're very popular, and people feel like they're doing their body good by having them in the house.
Well, and certainly people with lots of allergies
Sure.
and a lot of severe asthma. I mean, again, it's, you go to an allergist, they tell you to take the rugs out, you do this. I think that population, they have more value. In terms of the average person, probably not.
And we're not curing cancer by having,
Right.
you're
Right.
not eliminating your risk of lung cancer by having them.
Right.
Jeremy wants to know, though, and this is just a good question, flat out, what's the most common way we're neglecting our lungs in general? What are we doing? What could we be doing better?
Well, again, population-wise, I suppose it's still smoking. And although adults have dropped to the lowest in a long time, now the younger folks are vaping and electronic cigarettes. And so people are still exposing themselves. I mean, that's probably the biggest thing that we can do. If you're a non-smoker and you're healthy, there's not much more you can do to improve your lung health. Now, if ozone days and this and that, you should cut down your activities so that you don't put yourself at greater risk. Because even healthy people, you get that into the lung, it could cause inflammation and set you up to get develop asthma. Again, we don't know exactly what level that would be,
Right.
but even healthy people, when we have those alerts, should cut down their activity. If they're out running or whatever, they should reduce that until the levels fall.
So Terry wants to know, if we're monitoring the air quality, does it make sense to wear a face mask? What would that protect from? Does it help?
Not in the general population. I mean, in certain industries where the dust is higher, yes. And most of those already have set up that they need to be wearing protection if they work in certain industries. But not on a daily basis. And there's not much, I don't think there's much science out there relative to, say, if you're burning leaves or whatever, that a face mask will help you. So I wouldn't, I don't think it's going to be of great help. It's not going to help with ozone. But if you had a lot of particulate and you're wearing a dusty job, or you're working, say, where there's a lot of dust off the highway, rock dust or whatever, and you have lung disease, you probably ought to wear one there.
Makes sense.
But not in the general population going to the grocery store or church or something like that.
Joellen has our last question. When the COVID pandemic started, we remember all the discussion of indoor air quality and air exchange and all the things. Dr. Barkman, what did we learn? Did COVID help us learn more about air quality inside?
I haven't seen any studies addressing that per se. I do think that there are some studies that show that if you, in areas where pollution's higher, there is more risk of respiratory infections, and so people in that particular might be at more risk to developing COVID. I mean, that's a small population, but I think it does exist.
Exists. It's sorting through a lot of different elements, isn't it? It sounds like, with this. Dr. Barkman, always great to have you. What's today's takeaway? If somebody was going to take home and really let this soak in, what do you want them to walk away with today?
Well, I think they should walk away that, hey, listen, we are paying attention to air quality. We need to continue to pay attention to it and support your local areas and when they want to improve air quality. Stay updated on, especially if you have lung disease. And I guess in terms of healthy things, tend to, if you can avoid the use of emissions by using the car less, so be it. It all helps.
Do your part.
Do your part. And it's going to take a long time to get to where we want to be, but we're making progress.
Good. Ending on a positive note. Dr. Hawkinson, today's takeaway from you.
Yeah, I would just echo what Dr. Barkman says. do your part and understand those risks that you are going to be doing, but also do your part as far as your actions and what they lead to as well.
Thanks to all of our guests, or our one guest, and Dr. Hawkinson. Always good to have you both with us. Thanks to all of our viewers, your great questions. And we will see you back here tomorrow at 8 a.m. Cancer can rob a woman of their hair, even their breasts, but we can't let it claim their self-esteem. I'm Jessica Lovell. On the next Open Mics with Dr. Stites, we visit Missy's Boutique and explore the science proving headscarves, wigs, and prosthetic chests are crucial for cancer patients. That's Wednesday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.